And so I want to give a scenario that is not a real scenario, but it's one that I see played out day in and day out. Now, Margaret has diabetes, high cholesterol, and high blood pressure. Her feet have burned for a long time off and on, and she's felt that, as well as throwing her hip and back out occasionally. You know how she stands up, lifts something, ouch, 3 days, a week, she's immobilized and she gets back into it. Well, she also is obese, which means her BMI is above 30, and she has sleep apnea, but she doesn't wear a mask because she doesn't like the way it looks, right? Now, one morning she, at the age of 64, was walking to church and she began to feel chest cramping. Not terrible, but moments later her stomach became nauseated, she became somewhat diaphoretic, she had to sit down, she was dizzy, sweating, and jittery, and she could feel some fluttering in her chest. What's happening? She's having a heart attack. So a passerby sees her, calls 911, and she goes to the hospital. After a week, she was discharged home, where off and on she's admitted to the hospital for congestive heart failure over the next 5 years. During this time, she gained 54 pounds because she wasn't able to be active. Now, that's not really all that remarkable, because a lot of that's fluid that gets stuck in your body because your heart can't push the blood. And the average American's gaining 5 to 10 pounds a year just on their own anyway, if they're not paying attention to it. And so one night while lying in bed, she became more short of breath, felt her heart flutter, called 911. She was taken to the hospital where she was diagnosed with atrial fibrillation. Now, AFib is very common in people with sleep apnea. And it's because these folks are getting choked off, their heart gets thrown out of rhythm, and they're in this rhythm called AFib. And in this, what happens is the top part of your heart's not beating properly, blood clots form, and she had one go to her brain and had her stroke. She was discharged to a nursing home where, after a year, at the age of 73, she passed on. This is the average scenario for the average American today. This is what happens day in and day out.